So apologies for anyone who was expecting another speaker. You're stuck with me for another 20 minutes. I'm going to be talking about nurse leadership. So one of the things when we think about nurse leadership is if you were to look at, say, another group of people working together, so maybe a football team. Think about a football team. If there was one person, one position on the football team that was more important than any other, who would that be? You know, if you were thinking of the goal scorer, maybe you'd be that person. You can think of some of those great football players. But I would argue that the most important person on a football team, and you know, in Canada, we're big hockey fans. I think in this part of the world, you're also big hockey fans. We always think the most important player is the goaltender. And so in long-term care, I believe the most important person really is the nurse leader. And when you're a nurse leader, those of you how many of you are the head nurse of your organization? Can I see a show of hands? There must be lots of you. I see, thank you, I see you waving, thank you, you're waving, thank you. That's a lot of you are the head nurse. So from my point of view, you're the most important person in that organization because you set the tone for everything else, but then you're not always on the front line. You're here right now, so somebody else is leading the staff that Robin was talking about. So those people need some support and some skills to do that. So I'm going to go through briefly a couple-day course. This is about a 2 or 3 day course. I'll try to do this in the next less than 20 minutes and show you some of the highlights. So if we can get the slide deck loaded up, we'll get going. I think there should be a slide deck on. There we go. Okay. So as Robin mentioned, in Canada, the frontline staff. This is during COVID. As you can see from the slide, in Canada, the United States, and other countries, immigrants come to our countries and they end up having those jobs. Most of them are women, and they're caring for older people. So if you think about those 3 isms, you think about ageism because of who they're caring for. Secondly is the color of their skin, so you can call that racism. And then the third is the gender, so there's sexism. So you think about why do we undervalue long-term care? It's for that reason. So our job is to build up the industry. We were, as Robin mentioned, we were in Scotland 3 weeks ago, and in Glasgow, some private nursing homes where the staff members were on the front page of the newspaper. So I wanted to find out what was going on. And you know, as you can see, if you can read the English, it says, "Heroes treated like zeros." So in Canada, and you might have done the same thing here, every evening during the pandemic, we would go outside, bang our pots, and cheer for these staff. And people were doing it who had nothing to do with a nursing home, nothing to do with long-term care. They just saw it on the news, and they wanted to do something to help our industry. And so the workers now are saying, what happened to that? Why aren't we being valued? So I think we have to think about how do we value this sector and the staff that are providing it. This is a graph that shows the number of long-term care workers for people who are seniors, say for 100 people. So if you have 100 seniors, how many people are working in the industry? And you can see, as you would expect, on the far left, you'll see Norway, Sweden, Iceland, those Nordic countries, they have a very high ratio of people. Canada is kind of on the lower side. Poland's on the other side. And I just wonder, why do we have that disparity around the world? Why do we have some countries that are really heavily staffed in some places, Canada, Poland on the other side? And why is that? And so why isn't this an attractive industry to go into? I think all of us in this room, we love what we're doing. We're going to end up doing this the rest of our lives. So how do we attract more people? And how do we make this a priority for governments to want to fund staffing? Because we're going to need more staffing, not less. And as you can see, those rectangle shapes, that shows the number coming down. So there's less staff now than there were when they first measured this. So we have to go the opposite direction. A little bit about burnout. I know burnout is much more complicated than this, but if you think about the orchid, right? If you know anything at all about gardening, you would know that an orchid needs the ideal conditions. It needs a temperature that is tropical. It needs lots of moisture and watering, a certain amount of fertilizing, but it needs exactly the right amount, the right kind of soil. If you don't have that, orchids die. I know nothing about gardening, so I know if I had an orchid, it would be dead probably before I even bought it. So that is basically, if you think about that, that might be kind of analogous to burnout. Okay, so how do you go from the orchid, and which one are you, but how do you go from that to the dandelion? So I haven't seen any dandelions in Poland, but I'm sure you have some kind of weed like that. Maybe you have dandelions, maybe they're in your grass. We have lots of them in our backyard at home. So dandelions, they're kind of like cockroaches. They can survive anything, and they flourish in all environments. So we talk about the opposite of burnout is resilience. How do we build resilience in our teams? And I think the nurse leadership idea is something that helps. So I'll try to be as quick as I can because I know there's another speaker and then we have our lunch. So we're going to go through the learning outcomes. We'll talk about the various workplaces and the roles that nurse leaders have. We'll talk about supervisory responsibilities, some best practices around collaborative relationships in the team, and also self-reflection and goal setting. And then our themes, most of this course is taught online. And if anybody is interested in this course, I can make it available to you. It was produced in just outside of Vancouver. And so there's the various changing workplace roles. The nurse leader's role is changing. It's not the same as it was when many of us entered the field. And also, how can you be mentors? How can we mentor our peers? So the first thing is collaborative leadership approaches. There's a video that's called Conscious Leadership. You can go online and look it up. But essentially, think of this. If we're below the line, if your perspective of the world and life is below the line, it means this. And some of us, we do this. And it's hard to get out of it. But here's what we might do. You might find yourself always having to be right. Do you know that person? If it's not you, you probably know someone. When you're talking to them, they're always right. Okay? So if that's you, or you work with that person, this will help them, okay? Or it might help you. They're always defensive. They're never wrong. It wasn't me, it was somebody else. I never did that. The defensive person, you know that. They'll say, it wasn't me, it was you. And then they're closed-minded. The only thing they believe is what they believe. They will not accept anything else. Their reality is the only reality that exists. Am I striking a chord? Does anybody know people like that? Now, if you're above the line, then everything, you're open to opportunities. You might end your sentence with the word, I haven't done that yet. I haven't thought about that yet. That's interesting. You're curious. You're always wondering, oh, what's that next thing? I want to find out about that. There's a new food. Let me try that. And then you're always committed to learning. So think of that, your conscious leadership, and check yourself. So that's that piece. There's a framework. So if we're going to do leadership, we need a framework to do this in. We think about your skill set, your abilities, your knowledge, in any part of the organization. Specifically, we'll talk about the individual within organizations, but this could be in any part of the health sector. So it's a pretty simple one, but there's 5 pieces to the leads framework. It's lead self. How do you lead yourself so that you're not dependent on other people? So when you come to work, as we heard earlier, you're ready to go. You've dealt with your stuff. Your bucket is filled. Okay, it's our job is to have our buckets filled when we get to work. The next one is that you're giving it all to engage others. You are developing other people. So our job as leaders is that servant leadership model. If you're religious, you would know Jesus was all about servant leadership. He was about helping others get better. And that's what our job is to help others be the best version of themselves. Now, all that's nice, but then we got to achieve results. We got to get stuff done. So using that leadership piece, we're making sure that we're setting the direction and getting outcomes. Now, you can't do it alone. Even 2 people can't do it. So we got to get coalitions. So your coalition is with the whole care team. It's with administration, it's with the families, it's with the residents, it's with the broader community. So we need those coalitions of people to get stuff done. So if you're trying to change the culture of your organization and focus on person-centeredness, we've got to have those teams. And the last thing is systems transformation. By the way, in long-term care, the systems transformation could be the way the laundry is delivered. It could be the way you do your toast. It could be changing your staffing room. When we introduced coffee machine one day, a new coffee machine, it made a big difference. So how do you transform the systems that you're operating in? It could be your medication delivery system. How do you do that? I want to talk about moral distress and ethical decision making. So in nurses' professional practice, if you have ethical standards, if you're a nurse, if you have a professional background, any of us belong to a body, a professional body, we should know these almost off by heart. But it's a good thing to kind of check those, know them so that you can help manage yourself when you have ethical issues. So as a profession, you have those. You can use those to check in and to deal with how you can improve communication using that background. And you can also evaluate the appropriateness of your actions. So moral distress. Moral distress is defined by the effect of knowing the right thing to do, but finding yourself unable to do it either because there are internal or external barriers. That's moral distress. So it's kind of like seeing that thing and not being able to do it. And then ethical decision making, it's a process where to make logical and consistent decisions to determine the most morally desirable course of action in the face of conflicting value choices. So one way of dealing with this is super simple, but I'm going to go through it quickly. So it's a tool for you to use when you're feeling moral distress. Okay, so you can think the first thing you do is you ask the question, affirm, assess, and act. So here's the first one. So ask. So you may feel something, but you're not sure what it is. What's the source of that distress? Why am I feeling that way within the team? What's going on? So it's simple, but you ask the question and you become aware that moral distress is present. So you recognize what's going on. You call it out. The next thing you do is you affirm and you make a commitment to take care of yourself. This is about you. This is about self-preservation as a leader so that you're able to lead others. And then you validate those feelings. You might ask somebody else, have you noticed this? I'm feeling this. And they'll validate it for you. They'll confirm it. And then your professional obligation is to act. You must do something about it. So you make that decision to address the moral distress. And now you assess the situation. Is it a personal issue? Is it the environment you're in? And then you have to figure out the level of severity. Is it a scale of 1 to 10? Where is it? How serious is this? And then you got to get ready to take this on. Now, some of you were probably thinking about an issue, a thing that you've been dealing with, and you're going to take it on. And then you got to figure out the risks and benefits. If I act, what would happen? If I don't act, what happens? There might be an example of a financial abuse from a family member. What happens if we stress out that relationship even more between the parent and the children? What would happen? And then you have to make your action plan. So you get ready to do that. Then the last thing you do is you take your action and you initiate the change you want to see. And then you want to maintain that change. So you go through the cycle again. But your goal is that you maintain your integrity and your authenticity. 4 A's of overcoming moral distress. It seems simple. This might not work for you, but this is something that we're teaching in Canada, and we think this has some merits. Ask, affirm, assess, and act. Okay, the next concept. So ethical decision making. And often ethical decisions and ethical issues are all about communication. People aren't communicating well. So the first thing you want to do in ethical decision making is describe and identify the issue. What is it? And maybe our example today could be that the family members have said, Mom at this point in her life did not want to be fed, but we're still feeding her because we don't want to deny her of the right to eat. She's still responding, but previously she said she didn't want to be alive at this point. So that's your ethical decision making. Long-term care, ethics isn't really front page of the paper stuff. It's stuff that's more subtle. Then we gather factual information about the issue. We clarify or challenge the problem. You identify actions that you want to take, and the best solution might not be obvious at the time. And then you look at what the policy and legislation is in terms of the advantages, limitations of each. Then you decide on what action you're going to take. And you implement your decision with thoughtfulness and sensitivity, and you assess the consequences of your decision. So it could be something around feeding. It could be something around giving treatment for somebody. It could be even how you distribute some scarce resource. It could be in long-term care, who gets to eat first. Whatever those moral decisions are, those ethical dilemmas, it's something to do. Okay, peer mentoring. We're going fast through this. Some of you probably are already doing peer mentoring. It's really supporting somebody else who is an equal to you. So here's our definition. Peer mentoring is this. It's a reciprocal, collaborative learning relationship between two people, it could be more, who share mutual responsibility and accountability to help the person being mentored, who's called the mentee, work towards achieving a clear, mutual, defined learning goals. And the main goal here is the process of learning. So that's the product. So it's the whole person that you're developing. There's different ways of doing it, and you need to build in a trusting, supportive relationship. The way I do it at work is someone will come to my office and we'll have a chat, and we have these goals, and we sit down and have that conversation. It's that simple. Sometimes I'm mentoring people who have found me, and they know I do this, and I'll meet for them for coffee. So I know I'll be happy in the environment. I'll have a nice cup of coffee, as are they, and we have this conversation for about 45 minutes. And then we meet again, and we have goals that we're developing. Okay, moving right along. Self-reflection and goal setting, super important stuff. So reflective practice. I don't know if you have time to do this, but because you're always rushing, you're going from meeting to meeting to meeting, try to find time in your schedule and block off maybe 10, 15 minutes to do this. And you might think, Dan, I can't do this. This is a luxury I can't afford. But if you have time to reflect on conversations and on things that you're doing, you'll be more effective as a leader, as will your team being if they have that chance. So, and you can think about, how could I have done that differently? That conversation I had didn't go as well as I wanted to. What could I have done differently to make it better next time and make it better for that person? So what are the benefits of doing this? It helps. This is a very complex environment we're working on. There's so many factors going on that affect all of us, and it really is something that we can do to help improve our own ability to lead. And you can actually think again for how can you be better next time you're in that situation. You can recognize your own assumption and values, and how does my perspective from where I come from affect other people, that I'm not putting my personal beliefs and values on somebody else, because that might not be what they're looking for. And then you can actually kind of navigate that, because somebody else's values might be contrary to yours, but maybe contrary to the person. The feeding example, they might not think that was the right thing to do, but your organization has certain values, and you got to follow through. So this should help deal with frustration and confusion. So I think this might be almost towards the end here. Our SMART goal setting. I'm going to be asking you to do this yourself. And if you want to look me up on LinkedIn or connect me, I'd love to hear that you did something and you took this away. So SMART goals, you've probably all heard about these. So what you can do is, if you're going to have a goal, something that you want to do to set for yourself, it can be specific. So write out exactly what it is. Make it simple. Don't make it complicated. You probably will never do it. It's got to be measurable. You've got to have a goal that you're trying to achieve that you can evaluate in terms of hitting that number. Achievable, something that you'll actually do. And it's got to be realistic and results focused so that you can measure those outcomes. And it's got to be time focused. It's got to be something that you do timely. Now, I'm going to make a total apology to all of you and a confession. It's a confession I'm going to make. I see a physiotherapist. I saw my physiotherapist, Tom, 10 days ago. I have a meniscus issue from running in my knee. By the way, my right knee has the issue. My left knee does not have it, so I can't say it's because of aging. Because if it was from aging, then my left knee would also have the same problem, right? So anyway, I have, for 10 days since seeing Tom, I promised him I would do it. I haven't done one. So I will do one before I go to bed tonight. It's 3 exercises, about 15 minutes. So I'm making my commitment, hoping you'll make your commitment also. So here are some examples, things that you can do. Now, they may not seem realistic, but try to do them and encourage, if you're doing them, try to encourage, or I'm invoking you to do it with the team that you're leading. So here's something you can do. Have a specific goal of freeing up 2 hours a day. If I could give you 2 hours a day, how many would say yes? You all would probably say yes. What does that look like? You're going to delegate something that you're doing yourself, because you probably think you're the only one who can do it right. Delegate that to somebody else. That will free up your time. Okay? If you're the nurse leader, you have staff that you can do this with. Maybe she's sitting next to you right now. Then you can also figure out, if you're working a 12-hour day or a 16-hour day, some of us do this, think about how you can be more productive. And that might hurt a little bit to hear that, but there may be ways you can be more effective in what you're doing. The next thing you can do is you can say to you're going to do some training for staff. Maybe you'll do a course like this. But if you do that, write down the date and the name of what you're going to do, that you're going to implement that new system. And then you can also, just when you work with staff and you have a meeting and you're coming up with an idea, you can say, what date will it be done by? And the last thing you can do is you can do something like hold monthly discussions and staff meetings on how the competencies that nurses have or the frontline workers have can be applied to the work they're doing and have discussions with people. Those kinds of things you can do right now. There may be other ideas you have, but I'd encourage you, before you go back to work, write down a SMART goal, bring it back, and I'd also encourage you to the person who sent you here, the person who approves your expenses, tell them that you did this. Okay, tell them, say, thank you very much for sending me to Torun, and I've done something. I have a SMART goal, and this is going to improve my own satisfaction at work and the team satisfaction. They probably appreciate that. A final activity is reflection. Again, seems pretty simple. When you reflect back on this conference, think back of what did you learn. Maybe make some notes of what you learned. Share it with your team. And then you want to then write out why was that significant learning. And the last is what will change as a result of the learning. What are you now going to bring in where you work? And then think about maybe having 1 or 2 SMART goals that you can implement at work. So here are the themes. We talked about supervisory responsibility, nurses as leaders, leadership skills, being reflective and mentors, our outcomes we talked about already. And here's the result, okay? Take a picture of your team. This is our team at work. You'll recognize the guy there with the red pants. And I can tell you, every one of them has something different. This guy here, Adrian, he's one of the only workers we have who was born in Europe. And all he wants is one thing from me as a CEO, because he reports to the guy, Jim, who's the CFO, our Chief Financial Officer. All Adrian wants is once a week, he wants me to walk with him to the Starbucks to have a cup of coffee. That's all he wants. And he wants to tell me about what's going on in his life. I tell him about what's going on in my life. That's all he wants, and that gives him enough to keep on going. I can tell you, this guy here, he's the guy who developed our pureed food. His name's Adam. And he comes to see me every morning and tells me stuff going on in his personal life, what's going on at work, and it charges us up, and we keep on going. I could go through all the people there. Oh, the lady there doing this in the top, she's a care aide, and our unit clerk, who's our receptionist, is gone on mat leave, and she is smiling just like that all the time. She's now doing the front desk. And I can tell you, all those people, they always want something from you. There's something that you can give them to brighten their day, and it might just be a few minutes of listening. And you're probably already doing that. But just know that when you're doing that, how appreciative your team are. So I think there's a clock here showing me the minutes or seconds left, so we're basically done. So thank you very much for the opportunity to come and give 2 lectures today. Thank you.